Good morning, good afternoon, good evening, wherever you're listening from. Welcome to the Change Management Simplified podcast, where we will explain and discuss what change management is really about, using real examples alongside principles of change management based on our experiences on projects, transformations, change initiatives, and of course, the home experiences as well. Hi everyone, welcome back to the Change Management Simplified podcast. Thank you for coming back to listen. Thank you for subscribing. Thank you for following. Please continue to press that follow button on Spotify and Apple and subscribe on YouTube and all the other platforms. That just gives me an idea of how many reoccurring audience or reoccurring listeners are coming back, and it just gives me a little bit more motivation that you do enjoy these topics. Right, and for today, we are doing episode 28, that's 028. And we are going, and I say we, it's me and Chipo again, part 2 of the discussion we started in the previous episode 27, where she shared her experience in terms of how she managed or prepared to make a career change from finance in the corporate world, working in the office 9 to 5, but I say that with caveats, we never do 9 to 5, to mental health nursing. And I say that with a big, deep breath because it is a drastic change, and I think it takes someone very brave to take such a decision. But she focused on how she prepared, but also what that entailed in terms of preparing her mindset and, of course, having the framework behind it. Now, in today's episode, she is going to focus on, or we're going to focus the discussion around how she managed this change once she got accepted, what she put in place, what practical steps that she had to follow or put in place while she was undertaking this retraining into a new career, new specialism, which takes a lot of effort. Now, for an adult like us, it's not the same as we were, back at university in our late teens or early 20s. So it takes a lot of guts, passion, and desire if you want to set off on such a path or decision. And on that note, let's get into the discussion with Chipo. So how did you get to go to start your degree in nursing, to do your postgrad in nursing, to specialize in mental health?
It was all. Do you know what? It was all. I told myself, right, I'm going to apply for this nursing degree. If I get accepted, I will go. If I don't get accepted, then maybe I would go back into the world of finance. As the universe and God would have it, I got accepted to the very first place I applied for.
Oh.
So I thought, right, let's do it. Let's go with it.
It's a sign.
Yeah, it's a sign. I took it as a good sign. Let's go with it. And from the beginning, it was a challenge because before I was fully enrolled, I had to do a series of assignments. I wasn't a student yet, but I had to do a series of assignments. I had to prepare a presentation before going for the interview process to get onto the course. And I suspect this was because I applied to go on the master's route.
Oh, so what is that? So what routes are available to you, and what is the master's route?
So there's the bachelor's, which is the standard 3 years training to become a nurse. And then there's the master's, which postgrads can do. If you've got a previous degree, you can apply to go on that. So I would say the assignments and vetting that I had to do was to sort of gauge whether I would be suitable. because obviously my initial degree being in finance and business systems is completely the opposite spectrum of nursing.
Very, very
Yeah,
different.
so you get a series of sort of biology, science, human physiology type assignments to complete. You then have to sort of go through the code of conduct for nurses and
Mm,
explain how you feel you fill those criterias, whether you're feeding it from what you have to appreciate is there's a lot of transferable skills. Even though the careers
okay.
are different, there's a lot of transferable skills that you can actually hone on. Because yes, we're nursing people, but we also need to know systems. So I was at an
Mm,
advantage of that. We also need to know policy. I was at an advantage of that. We need to be able to communicate. Yes, I
yeah,
communicated with systems, but when you're doing those reports and the finance director says, "What is this and what are you doing?"
yeah.
You need to be able to,
Be able to explain.
so you had to kind of hone in on those transferable skills and present it in a way that it would be able to be used in a nursing environment. So that was a challenge in itself for it to not look like I was sort of leaning heavily towards finance,
Yeah.
and actually make it relatable. Um,
Okay.
so yeah, so,
So,
so it was a whole process, but going through that as well for me was like, right, I remember I enjoyed biology in college. Yeah, love this. This is good. Oh, I remember doing this and I really enjoyed it. So I knew that I was going in the right direction. It was never a chore. It was actually, oh wow, this is exciting. I don't remember doing this for so many years, but I've just remembered that there was a time when I enjoyed this. So yeah, so for me, I think it was meant to be, let's say.
do you know what you're saying that? But when you said you had to, when you mentioned that you had to do some biology assignments, I'm thinking biology? There's absolutely no way I would start remembering anything that I did in biology and be able to apply it
You'd be
in another
surprised.
professional
Oh,
environment.
you'd be surprised. Like riding a
Really?
bicycle. You never really forget.
Well, I don't quite know how
Oh,
to ride a
wow.
bicycle even to this day. I know. I'm gonna try. The kids have told me that I had to learn, and they want us to go on a bike ride. So yes, Brandon said I had to learn, so we can go on a bike ride, on a family bike
Oh,
ride.
yeah. So
So and then the masters. So you went through the assignments, and then you do a presentation.
yeah, I had to do a presentation in front of my peers, who were other people also applying to go on the course, as well as a panel from the university. Um,
Oh, that's a huge presentation.
yeah, it was, as you know, I do not like speaking in front of people. Absolutely hate
Yeah.
it. So for me, that was a challenge. So yeah, that was part of the process, and then afterwards they then tell you whether you've got a conditional offer or a complete offer. And luckily for me, I got a complete offer after the presentation.
So after that, then you did your master's two years?
Yeah, so then this whole interview process went ahead at the beginning of the year. So I think it was just before the lockdown, actually, the February before lockdown. And then I didn't start till September. So that the rest of the time I carried on working as a support worker. And then in September, it was to uni, but being locked down, everything was online. So our lectures were remote. We did have to go into face-to-face practical training because you cannot possibly
You can,
learn
yeah,
how to use a blood pressure machine over a computer.
a computer,
So yeah,
yeah.
we had to go in for certain practical sessions that had to be done in-house. The whole PPE donning, we were all covered up. We were doing what was required at that time. Um, And then, yeah, and then that was it. We go on our lectures. It was a bit of a struggle at the beginning because they weren't sure if we would be cleared to go on placements, because that would mean going into public hospitals potentially, where, COVID was rife, or, you would be faced with other illnesses. But we had a very amazing occupational health team that supported us through all of this and made sure that any students that were vulnerable were given a different plan. And also you could opt out. There were options to opt out of going into places, so it wasn't forced. It was very, very supportive, just very easy, communication was good all throughout. And then, yeah, that was the 2 years of training, intense. Having gone through the 2 years condensed degree, I wouldn't recommend it. It's very stressful on the mind. There were times when, I won't lie, I thought, this is it. I'm going to quit. I can't do this anymore. It's intense. You've got assignments. You've got to go on to practical placement training. I'm a mother. I've got to still deal with the household. It was just all too much to be condensed in 2 years. And I can only thank my lucky stars that I made it through those 2 years. So, yeah.
So, well, I was just about to ask you, how did you manage to balance everything else in your personal life, plus now your new career adventure? Uh, Considering the fact that, as you say, as you've got a family, you cannot, a young family especially, you feel like you cannot let yourself down,
Mm,
but also your family, because you are a leader back home. And I keep saying to people, leadership is not just at work, it's at home as well.
mm,
So you have to keep the brave face and the smile and still be able to maintain the household as you as a mother, trying to balance a new career change plus also being a mother at home.
mm. Absolutely. Yeah, it was a challenge. It was a very big challenge, but luckily for me, I have a family that understands, a family that's very loving. My parents as well, my whole entire family just pulled through together and gave me the strength that I needed to do it. So, yeah, but looking back, I remember getting towards the end of my course and thinking, oh gosh, if I had to do this all over again, I would just do the 3 year course and spread it out.
That's your recommendation to anyone trying to who would like to do that adventurous journey?
If, yes, in a way, yes. However, I still won't knock the masters. I still won't knock
Mm,
it. Um, you do, to some extent, learn the same things. You still go through the same processes. It's just more condensed, so you won't have as much time off as you would, say, if you were doing the bachelor's. You'd have a lot more time off to sort of get yourself together, relax, spend time with family. Whereas on the condensed course, your time off isn't your time off, because you're still having to complete assignments that are due in at the end of your time off, you know.
mm.
Yeah, so, either one is good.
Either
It's
one is
just
good.
a matter of personal preference.
Okay.
Mm.
So now you are now graduated. You've got a master's in nursing in mental health. Very proud of you, by the way. And also, just I did want to say this at the beginning, but I don't know. I think I've said it. I'm sure I've said it to you before, but it never surprised me, or I wasn't surprised that you ended up in nursing because you've always somehow, even when we're back, back at university, even actually I think before university, you were always around that profession. And also our lovely young moms, the twins, I think they've had also very big influence on you in terms of career change, but the inspirational, because I do find them very inspirational ladies. They're very hardworking and they set off on their medicine journey. Just like I think one of them started off in a different career path and
Mm.
then ended up in
Nursing as
nursing, and
well.
then I
Yeah.
think she's gone into,
Yeah.
yeah. So it didn't surprise me, but I think it naturally also worked with you. So I wasn't surprised. I was not surprised that you've ended up in nursing and enjoying it because you talk about it with so much joy and satisfaction. Unlike when you were in finance.
I agree. I agree. Like I said, I did like my jobs in finance. I loved the teams that I worked with. I met some people that are lifelong friends now. But it never gave me that, wow, I love my job feeling.
Yeah.
It was more because I was around such good teams that I managed to carry on. Um, Whereas now with nursing, I can honestly say I love my job. I absolutely love it. I love the clients that I work with. I love the teams that I work with, but it makes me feel happy.
Yeah.
Yeah, it's challenging. I'm not going to lie. Mental health nursing is very challenging. And unfortunately for us, sometimes, just in passing, this isn't on anybody. Mental health nurses often get told we're not real nurses by sort of like general nurses who are
Oh,
more,
oh,
yeah.
okay.
But we are nurses, and what we do is very hard, is very difficult. It takes a special kind of person to be a mental health nurse, and all the nurses that I
Okay.
work with are very special, amazing people. Um, but I love my job. I absolutely love it. I look forward to going to work because no day is ever the same. Um, there's days that are challenging where you want to sit in a corner and hold your head and go, what am I doing here? And then there's days when you're just laughing constantly with the clients and just having a great time. So it's very different. Every day is very different with the clients, and I absolutely love that. And I love seeing progress as well, because yes, they might be in hospital facing mental health, but actually it opens up this whole kind of issue on mental health. Like, it's everywhere.
It is. It is indeed. And I would like us to talk about that in part two
Mm.
of our interview. So, apologies for cutting you short on that. But I'm happy that you made this career change because you are more smiley, more passionate. I see more passion coming out when you talk about it, which is great to see. Um, and yeah, continue doing what you're doing. And anyone who's listening, and as you've heard Chipo here, if you do feel you are ready to make a career change, as you know, how she summarized it, or how to summarize it, which was she leveraged off her previous experience plus qualifications, looked out for courses that uh, could leverage that. She had some trial runs. This was actually over several years. You know, she would dip in and out, but then intensely towards the end, she kind of got to, to spend a bit more time in her specialty, which was mental health, which, got that light and inner light and passion out of her. And then went on to do her degree, and now she's a full nurse in mental health. A drastic change from an accountant to a nurse. Would I do it? No, I wouldn't. But again, I don't have the passion for nursing, just, like the way Chipo does. At the same time, some of you get confused about what I actually do. Sometimes when I tell you I'm an accountant, you're like, you are? But you're a change practitioner or you're a project manager. I'm like, yes, but I'm an accountant by trade. It's what got me here, but I've specialized in different areas. And so, yeah, so anyone considering career changes, just be brave. Find something that you're passionate about. And listening to Chipo, it's about where you feel you add value. And when you finish at the end of the day, like on a long shift of 13 hours, 12 hours, do you feel like you've added value and you're happy that you've done your job. And then when you wake up tomorrow morning, are you excited or are you happy to be going to work? That's the question that we need to continuously ask ourselves. Um, and yes, Chipo, I'd like to thank you for talking about your career change and how you prepared for that change. And when I say to people, we practice change management every day in our normal lives,
Obviously.
but we just don't realize
Hmm.
we're doing
Hmm.
it. You've just demonstrated that through your career change journey. So, everybody out there, change management is not a complex topic. It is crucial. It's fundamental to if you're going to make a change, just like Chipo has, Chipo explained. So please keep doing it, prepare for it, and ultimately you will get to success. Now, on that note, thank you for listening. For next week, we'll come back with our final discussion with Chipo, and we will be focusing on leveraging her experience in the finance corporate world versus now what she sees in the health sector, focusing the discussion around mental health at work. I would like to pick her brains, or I pick her brains and her experiences in terms of what she's seen that works well in the health sector that potentially we could do in the corporate world, but also what are we doing that maybe could be improved? What are we missing? Um, just to bring the topic to light, because mental health or mental well-being is essential to everyone in this world, and the stats that I've come across are ridiculously quite worrying. So, and on that note, I will leave the discussion, the in-depth discussion, for next episode, and see you next time. Thank you for listening. Please don't forget to subscribe. If you find this podcast beneficial or interesting, please press follow, like, or subscribe. Lastly, and of course, don't forget to spread the word by sharing. Thank you for listening.